I'm Pat Brady. I'm from the western suburbs of Chicago. I practice in the North Shore of Chicago in Winnetka now. Bought a practice right out of residency. Been there for 7 years, and I'm by myself. We started using Grin in 2021 in January, February. We were going through a lot of staffing struggles, I think like everybody did during COVID. And also with social distancing being a thing, we were trying to figure out, what to do. Our practice was growing at the time as well. So, just lots of things that Grin solved for us. So it opened up treatment time. It also helped me keep touch with the patients a little bit better. I could give them feedback. They could reach me if they ever needed me. So yeah, it was great for our practice, and it's been 2 years now, and I love it. I was in a study club that always talks about treatment efficiency and really trying to increase revenue per visit. So that's always in the back of my mind. So it sounds like COVID kind of accelerated the growth of dental monitoring and Grin coming to market, but that definitely wasn't the main reason. I think the biggest reason was staffing issues and growth, trying to free up time in the schedule to not shoot ourselves in the foot, make sure we had time to provide a good treatment and patient experience when they were there at the office, but also realizing that people are busy, they don't want to come into the office, and if we can do something remotely just as well as in person, it's a win for everybody. The price point just made so much sense for us. It was a easy trade-off, to keep someone out of the office an extra 2 to 4 visits per treatment. It was just a win-win for everybody. For our office, it was always easier, especially at the time. We're maybe a small to medium practice. I guess it's hard to tell these days what an average size practice is. But I still look at all the scans myself. We have a aligner patient scan every 2 weeks, expander scan every month. Once they're stabilizing, we have braces patient scan every month. And it really hasn't increased my digital homework that much. So at some point as we continue to grow, I'll hand that off. We just bought a new practice, so I think we'll be there soon where we'll have enough staff that need some extra responsibilities. So that's one of the next things I'll hand off to my staff, which will be awesome. It'll free up even more time for me. I'll be able to review any difficult cases. But the initial implementation honestly was super smooth. Most people at parents these days, they're 30, 40, maybe 50s, but they're used to that sort of technology. It was easy for them to grasp and utilize. And it was, my staff loves it. So if aligners or expanders are the treatment plan, we're always bringing it up at the consults, and they love that approach, especially for patients that are maybe a little bit further away. They're going off to college. Just knowing that I'm, one video away, they can text me anytime, I think really calms some of their nerves with that long distance treatment. They all seem to love it. We haven't had any complaints. Definitely with our braces patients, once they're not brushing well, we definitely utilize that well to hassle them, and the moms and dads are so appreciative that kids are tough, especially your own kids. They're never going to listen to you, but if the doctor is bugging them, they know that we've got their back and we're looking out for their son or daughter.
Where are you based on?
I love the new progress scan feature. So my Grin rep stopped by my office right before the AO and showed it to me. And 30 minutes later, I posted on social media. It was the most likes of a story we'd have gotten, since we've been doing social media for the last year. It's just so cool to see that before and after those first few visits. So yeah, I love it. It's exciting. It's really cool. So I'm going to be using it a lot more for our social media for those sort of cases.